Alright, you ready?
Yep.
Okay. Don't be nervous. What?
Am I supposed to wave or
What's that
something?
on your tooth? What is that?
What is it? Oh, it speaks from Aphasia.
Hey everyone, it's me Lauren from Speak From The Heart, where I give you all things speech, language, and life. Yes, that was good. Hey. I'm a licensed and certified speech language pathologist, and I'm so happy that you're here viewing my newest video.
We're happy.
We're collectively happy. Yes, okay. So I have a special guest here today. This is my wife, Leslie. She is an IT developer, which is very different than speech pathology. So I thought of this crazy little video, and I'm going to be quizzing Leslie on how well she knows about speech pathology. She hears me talk about it all the time. Let's see if she's actually been listening over the past 4 or 5 years. And if she gets 85% correct, then she gets, drum roll, Chipotle! Hey, Chipotle!
That's my favorite.
Yeah. Or do you have anything to say before we start?
This is different because I'm loud in here, because usually you make me sit out there with headphones on. Noise canceling headphones, because I'm not allowed to hear anything that she says because I make her nervous. Am I making you nervous?
No.
Now? Oh, okay.
This is my show. I run the show.
All right.
All right. Let's see how well Leslie knows speech.
Question. Is it multiple choice?
No.
True, false?
No. It's essay.
Essay. Okay.
Are you ready?
I'm ready. I'm ready.
Question 1. What is the difference between dysarthria and dysphagia?
Oh boy. Okay. So, dysphagia, that's swallowing.
Okay.
That's a swallowing disorder.
Okay.
Dysarthria. Okay, let's see. Opposite of swallowing. I'm gonna say it's a language disorder.
Wrong. Dysarthria is a motor speech disorder that's caused by weakness of the muscles following a stroke or a traumatic brain injury, something like that.
I guess do I get half?
No, that's wrong. Because you didn't tell me the difference. So that's
I don't
wrong.
know the difference.
So let's write a 0, okay? All right, are you ready for the next one?
Yeah, why are you making it so hard?
Number 2. What does CCC-SLP stand for?
I got this one.
Okay, what is it?
CCC-SLP is Certificate of Clinical Competence - Speech Language Pathologist.
Yep.
I don't get to hear that.
All right, ding! You're correct. That's one correct response. High five. Do I have my CCC-SLP?
You sure do.
Okay, nice job.
Thank you.
All right, let's keep going. We'll do a 1 for that one for correct. How long is the, number 3. What's my finger? How long is the clinical fellowship year?
I think this is a trick question.
How long?
It's 9 months.
Yeah, good job. Don't doubt yourself.
Why do they call it a year? It's not a year. How about your clinical fellowship program?
Well, you want to write Asher?
Not really.
Okay. All right, you ready? So we're, 2 out of 3 so far. So not bad, not bad. Okay. Number 4. What are the 3 phases of the swallow?
Oh man. 3 phases. Okay, if I don't know the exact word.
Okay, just describe them. But
Okay.
they're 3. I need 3 responses, okay?
Okay. So there is chewing.
Okay.
That's the first phase, right?
Chewing, okay.
Mastication.
Uh-oh.
Okay.
Okay.
I listen sometimes.
Okay.
Okay, so if you're eating it, you're chewing it, and then you're gonna get it into a bolus.
Okay.
Right? Okay, right? Like,
But okay, I need to know what part is in which phase. I need 3 responses.
I need multiple choice. Okay. Did I get mastication right? Mastication?
Mastication?
Mastication.
Okay.
Sorry.
Okay.
Then phase 2 would be forming the bolus.
Okay.
Wait, let me see. No, then you gotta like elevate this a little bit to get it right. back here, right?
You tell me, I don't know.
And you go, and then you swallow, and then you just release the bolus. I don't know.
I don't know what the phases were, so we're gonna count that as an incorrect.
I think I explained it well though.
Okay, but mastication and chewing is the same thing, so it's in one phase. That's the oral phase.
I got that.
But then you said you masticate and then you form it into a bolus in 2 separate phases.
Yeah.
That's not right.
Oh.
It's one phase. That's the oral phase. Then you have the pharyngeal phase where the bolus actually goes into the pharynx. Then you have the esophageal phase, and that's really just like involuntary. The esophagus just squeezes it down. So oral, pharyngeal, and esophageal. So I'm sorry you didn't get that one correct, but that was a good try.
Mm-hmm. Like I'm not gonna be masticating any Chipotle.
So
wait.
Number 5. What is one technique that can be used for aphasia?
I go blank every time you ask that question. Like a technique?
Mm-hmm. Like something that I do when I work with people who have been diagnosed with aphasia.
You use functional therapy. Okay, I know that's not the answer to the question she's looking for.
Okay.
So you can
think about the one that I posted on my Instagram and I talk about all the time with the cards and the verbs. It's got an acronym.
It's got an acronym.
Mm-hmm.
Let's start with.
It rhymes with she best.
Huh? She best.
It's V-nest. V-nest. You know, I talk about that all the time.
I really don't recall this information.
Number 6. This one's like a yes/no question. Is it normal for a 4-year-old child to be 50% intelligible?
No.
Good job.
Your face gave away. You don't have a poker face.
Oh.
It's okay.
Number 7. Name one pediatric speech disorder. Speech or language disorder.
Well, stuttering, but that's not a. It could be pediatric or adult.
Yeah. Is it? Yeah. I'll accept that.
I was gonna say. Wait, articulation is that? That's
Yeah.
What, okay.
Good
I'll be
job.
second guessing myself. But
All
see,
right.
I know some of these things.
Nice. So we have 1, 2, 3, 4, 4.5 points.
You sure?
What is aspiration?
When it goes down the wrong pipe.
Okay, what pipe?
Wait a minute, there's 2 back there. So you have your trach. That's a pipe. No, that's not a pipe. Wait a minute. Oh no, wait. So what's the one for your airway? Your wait a minute. Esophagus. Hey man, it's not that funny. Okay, look. Okay.
Okay, sorry. Go ahead.
That's not your trach. That's not it.
It's not called a trach.
It's not. I know as soon as I said it, I
You're
realized.
missing a sound. Trachea.
That one.
Well, you're actually missing 2 sounds. A trachea. Right.
Trachea and your esophagus.
Mhm.
That's when water or food goes into your. Okay, let's see. It goes into your trachea because
Yes.
esophagus is for food.
Right. Nice.
Point, right?
Yes. Good. Yep.
Thank
So
you.
that's aspiration. Yeah.
AKA, it went down the wrong pipe.
Yeah.
That's what I say.
So we need to know what pipe. That's important. All right. You ready? What'd you say?
I said the wrong one.
Oh. Okay. What's the difference between a modified barium swallow study and a FEES?
Okay, so a modified barium swallow study is when you drink this stuff.
Okay. What's the stuff called?
A barium.
Okay. All right. Excuse me. All right.
Sorry. Barium, and it's like real chalky and stuff.
Okay.
Does it come in flavors still?
No.
Okay, well, didn't it used to come in chocolate and vanilla? Maybe that's something else. I'm thinking something else.
I don't
Ignore
think
that
so.
part. Ignore that. Okay, so you drink this stuff. It's like real chalky, so that they can this is an X-ray. This is
Yeah.
an active X-ray. So you are drinking this chalk stuff so that they can see the swallow.
Okay.
Bam.
And what's the FEES?
The fees when you put that thing in your nose and it go like this. and you gotta stay real still. And then they look at your, your stuff in your throat. And
The stuff in your throat, y'all.
Yeah, there's a lot of things in there.
All right, good. Very nice.
You just did that.
I did. I did do the fees
your
training.
class.
Mm-hmm.
And,
What part of the brain is responsible for auditory comprehension?
okay, like what are you talking about? Like,
Okay, so
I need some options.
we talk about like there's one part here, there's another part here. It's on the left side. Starts with a W.
Wernicke.
Good. Yeah, look at you. Yeah.
See, I just need these little cues.
And then what part is responsible for speech output?
Is that Broca?
Mm-hmm.
Because you get Broca's aphasia.
Yeah, you can also have Wernicke's aphasia.
Yes, you can. You can have Broca's aphasia and Wernicke's aphasia. Boom.
What's the other types of aphasias? Never mind, we won't go there.
I don't know. Aphasias.
All right, last question. Let's see, can she get it correct? This one's easy. Is it appropriate to send a child or refer a child for speech therapy for a dialectal difference?
No,
Why?
because it's a dialect. It's not a language disorder.
Look at you! Come on, you need to get your C's, girl.
No. I'm gonna stick to computers.
Very nice. Let's tally up your points. 77%. Aww.
That's average. That's a C.
Aww. Well, you didn't meet 85.
But I was close. Maybe I can get half a burrito. We can split.
We can split one.
Okay.
We'll split a burrito.
I want 77% of it though.
Well, let's give it up for Leslie. Woo, you did a good job.
I did pretty good.
Yeah.
I listened.
You too. Now, if this was reversed and she asked me about developer stuff, then I'd probably be at a 15%. So, good job. That's it for this video. I hope you enjoyed it. I would challenge you, if you have a spouse or a sibling or a parent, someone who lives with you or who's close to you, you should definitely do this challenge. I'm trying to think of a name of it, but just do the speech challenge. It's so funny when we ask people that we interact with on a daily basis, like our family and our friends, like how do they perceive what we do? So do it, record it. It doesn't have to be on YouTube. Do it on Instagram. I would love to see it. Make sure you like this video. Make sure you subscribe to my channel. And I will see you in the next one.
I probably won't.
Okay.
It's nice seeing you guys.
Bye.